credit video. Okay. From the top. Alright. Because you're gonna have me see. Okay. Knock, knock, knock. Hi, my name is Tina. Be a nursing student today. I qualified perform hand hygiene. And I do not need to wear PPE for this assessment. Can I get your name and date of birth?
Hannah Gearhart 21005.
And do you have any allergies, Hannah?
Nope.
Alright. I'm going to check your healthcare provider's orders. Looks like we're doing a tegometry and musculoskeletal assessment. That just basically means I'm going to make sure that you have range of motion in your synovial joints. And I'm going to make sure that your muscles have equal symmetrical strength and just make sure that everything with your skin checks out. Do you have any questions or concerns?
Nope.
And are you comfortable position?
Yep.
Okay, and then I do not have any any supplies that I need to cleanse or gather. First, I'm going to ask you a few questions. Do you see a dermatologist regularly?
No, not really.
No. Have you been having any struggles with like itchiness of your skin?
Nope.
Have you been having any problems with rashes?
Nope.
All right. Now I'm going to inspect your skin color. I'm looking to see if you have any signs of pallor, arrhythmia, cyanosis. All right, I do not see any. Now I'm going to be checking your skin for any bruises, lesions, scars, rashes, which I did not see any. Now I'm going to state the A, B, C, D, E. A is asymmetrical, B is border, C is color, D is diameter, and E is evolving. Now I'm going to be inspecting your nails. I'm looking for color, shape, size. I'm making sure that there's no clubbing. And then can you take your sock off? I'm going to have to look at your toes too. Looking for the same thing.
Okay.
Alright. Now I'm going to palpate your skin. I'm feeling for temperature, turgor, making sure there's no edema and texture. So your temperature is warm, your skin feels nice and hydrated. I'm not feeling turgor. Skin's warm, good and hydrated, no turgor. Texture is smooth, so that's perfect. Now I'm going to do your musculoskeletal. So have you ever broken a bone?
Nope.
Have you been having any problems with muscle pain?
Nope.
And how active are you?
Decently active.
All right. Now I'm gonna have you stand up for me. I'm going to check your anterior posture, make sure everything's symmetrical. Now I'm going to have you turn this way. Check your posterior posture, looking for any lordosis, kyphosis, or scoliosis, which I'm not seeing any. All right, now I'm going to have you face towards me. I'm going to have you put your feet together, hands at your side, and then I'm going to have you go ahead and stand there for 30 seconds, or close your eyes and stand there for 30 seconds. If you do any swaying or stepping forward, that'd be a positive test of Romberg. All right. Now I'm going to have you go ahead and do heel to toe. Yeah, heel to toe. Do 3 steps forward for me. And I'm going to have you do toe to heel. Okay. And then I'm going to have you go ahead and Slide your foot down your shin like this. And then go ahead and do it the other. Alright, and then I'm going to have you go ahead and put your feet together and close your eyes and then touch your finger to the nose. Alright, perfect. Now, I'm going to check your muscles for symmetry, shape, size, and strength. 5 is normal, 4 is slightly weak, like slight weakness, 3 is weakness, 2 is poor range of motion, 1 is severe weakness, and 0 is paralysis. So, first I'm going to be checking your sternocleidomastoid. So I'm going to sternocleidomastoid, so I'm going to have you turn your head left and right. And then I'm going to have you press against my hand. This side. Alright, now I'm going to be checking your trapezius. So I'm going to have you shrug your shoulders. And then I'm going to have you press against my hands. Perfect. Now I'm going to have you do your deltoids. So I'm going to have you put your hands out and then shrug. Right, and then I'm going to press your hands. Alright. Now I'm going to be doing your biceps. So I'm going to have you flex. You press it. And then extend, so that'd be your triceps. So press against my hands for your biceps. Press against my hands for your triceps. Okay, and now I'm going to do your grip strength. So I'm going to have you clench your hands and then grab on my fingers. Right, perfect. Now I'm going to be doing your, just a second. Now I'm going to be doing your hip abduction and adduction. So I'm going to have you put your leg out like this, like the abduction, and then putting it together, the adduction. Then go ahead and do it with the other leg, the abduction, and putting it together as adduction. Alright, so now I'm going to have you sit down. And I'm going to check your strength of your quads and your hamstrings. So I'm going to have you extend your legs, your quads, and then I'm going to have you bend your knees for your hamstrings. So I'm going to press against my into your quads, and then go ahead and press down your hamstrings. Perfect. So for each muscle, I was looking for symmetry, strength, size, and shape. So everything checks out good with that. I would rate all of your muscles a 5, so normal. Now I'm going to be doing your synovial joints. I am just making sure that you have range of motion. So I can have you sitting down. You're going to do your temporomandibular. So I'm going to have you open your mouth, which is extension, and then close your mouth, which is flexion, and you go ahead. All right. And now I'm going to be doing your cervical spine. So I'm going to have you look down, and then I'm going to have you look up. It's for flexion and extension, and then I'm going to have you put your ear to your shoulder, which is lateral rotation. So I'm sorry,
Okay.
and then I'm going to go ahead and have you do that while I feel. Perfect. Now I'm going to be doing your shoulders. So I'm going to have you do, I'm going to have you stand up for this one. This might be easier. So I'm going to have you do flexion, so above your hands, and then extensions behind you. And then I'm going to do abduction and adduction of your shoulders, so behind yours. And then abduction will be put your arms up to your side, and abduction. And then I'm going to have you put your arms like this, and then put your arms in. Internal rotation, and external rotation, external rotation. Now I'm going to, okay. Now I'm going to do your elbows. So I'm going to have you put them like this. So I'm going to have you bend your elbows like this. Flexion. And extend your arms. Extension. And then close your hands and supination. Pronation. And then I'm going to have you do flexion extension again. So I can feel it. Supination, pronation. Alright. Now I'm going to do your wrists. So I'm going to have you facing this way. So the extension and flexion. And then I'm going to have you do your hands. So I'm just going to have you close your fists. And then your fingers, I'm going to have you spread them wide open. That's abduction. And bring them together. That's adduction. Right? Now I'm going to, your wrists, I'm going to have you do rotation. There you go. All right. Now I'm going to have you do your hips. So I'm going to have you do flexion, so kick in front of you. Okay, and then extension, kick behind you. And then I'm going to feel with that leg. So flexion, extension. And I'm going to have you turn around so I can feel like do flexion and extension like that. And then I'm going to feel. All right, and then I'm going to have you do rotation. That leg. And go ahead and do it. And then rotation with this leg. All right. Now I'm going to have you do, I'm going to do abduction and adduction. So I'm going to have you, abduction is to the side. Adduction would be bringing your legs in, and then I'm going to have you do abduction to the side, bring it in. Go ahead and do it. So, yeah. All right. Now I'm going to have you do your knees. So I'm going to have you do flexion, which is bringing your knees up to your chest. I'm going to palpate that. And then extension is straightening them, and the flexion of your knees. And then go ahead and do it. Okay, now I'm going to have you sit down for this one. Okay. I'm going to do your feet, so I'm going to have you do dorsiflexion and plantar flexion, and then eversion on your pinkies, and then inversion is on your pinkies, eversion's on your toes, and then I'm going to have you do rotation. I'm not quite palpate that while you do that. All right. And then I believe that is it. So can I do anything else for you while I'm here?
Nope.
All right. And do you have any questions or concerns?
Nope.
You're comfortable to where you are?
Yep.
Okay. I'm going to do your 5 safety. Your bedside table is near. Your bed is low and locked. Here's your call light. Your side rail is secured. And your room is clear of any hazards. And then I'm going to perform hand hygiene for 5 moments in hand hygiene, or before I touch a patient, after I touch a patient, before I touch a patient, after I touch a patient, after I touch a patient's personal items, before a procedure, if my hands are visibly soiled. And then I would clean and cleanse my items, but I don't have any that I needed. And then I would document per agency policy.